As you learned, chest compressions alone may benefit a patient who is unresponsive and not breathing normally. However, providing rescue breaths to a patient in need may further increase the chances of restarting the patient's heart. After completing this skill, you should trust your training and provide an unresponsive patient who is not breathing normally with complete CPR, chest compressions, and rescue breathing. As always, begin by assessing the scene and giving your responder statement.
My name's Daniel. I'm an emergency responder. May I help you?
Tap the patient's collarbone and ask, "Are you okay?"
Are you okay?
to confirm unresponsiveness. After your responder statement, quickly open the patient's airway and check for normal breathing. If the patient is not responsive or breathing normally, as you've learned, ask a bystander to call EMS and secure an AED if possible. Again, if you are alone, call EMS first, then provide assistance. Now you'll give compressions as you've learned. Put the heel of one hand in the chest center on the compression site. Place the other on top, interlock your fingers, and position yourself with your shoulders directly over your hands, arms straight and elbows locked. Give chest compressions fluidly, using your body weight while keeping the force straight down, avoiding pressure on the rib cage or the lower tip of the breastbone. Press the breastbone at least 5 centimeters, 2 inches, and release after each compression, but keep your hand in contact with the patient. Count rapidly, 1, 2, 3, 4, about 100 to 120 compressions per minute. You give rescue breaths after delivering 30 chest compressions. Quickly place the ventilation barrier and open the airway as you've learned. Pinch the patient's nose closed and give 2 rescue breaths, each lasting about 1 second. Look for the patient's chest to rise. If you can't make the patient's chest rise with the first breath, reopen the airway before attempting another breath. Improper positioning is the most common cause for not being able to inflate a patient's lungs. After 2 breaths, whether they make the chest rise or not, begin another cycle of 30 chest compressions. You will follow that with another 2 breaths. Move between breaths and compressions as quickly as possible. Continue alternating 30 compressions with 2 breaths until emergency medical service personnel arrive. You can defibrillate with an automated external defibrillator. The patient becomes responsive and begins to breathe normally. Another emergency responder takes over CPR. Or lastly, you are too exhausted to continue. If more than one emergency responder is present, consider alternating care. To avoid fatigue, each provider can deliver CPR for 2 minutes and then switch. While switching providers, minimize chest compression interruptions.